Welcome to the special edition of Neurology News Network. I'm Marco Meglio. Please excuse our appearance this week as a majority of the U.S. workforce, including the Neurology Live team, moves to working remote as we come together to help reduce the spread of the novel coronavirus. This week's episode was centered around the 2021 American Epilepsy Society annual meeting, which took place in Chicago, Illinois from December 3rd to December 7th. First up, results from a post-hoc analysis of the PERMIT study, a pooled analysis of 44 real-world studies, show that perampanel is effective in treating patients with epilepsy who have comorbid intellectual disability, or ID, although the data was not as pronounced compared with those without ID. The findings also showed that the anti-seizure medication was generally well tolerated in both groups, with the incidence of psychiatric adverse events higher among those with intellectual disability. PERMIT originally included more than 5,000 patients with focal onset and/or generalized onset seizures treated with perampanel in everyday clinical practice. However, this analysis only included 735 patients with intellectual disability, and 1,890 patients without intellectual disability. Mean time on perampanel treatment was similar for patients with versus without intellectual disability, and at last visit or 12 months, responder rate, defined as at least 50% reduction from baseline, was observed in 37.5% of those with intellectual disability and in 48.5% of those without intellectual disability. Next up, results from a retrospective study found significant improvements in seizure frequency, anxiety, and depression in patients with psychogenic non-epileptic seizures when treated with cognitive behavioral therapy informed psychotherapy, or CBD-TIP, for more than a 12-week period. This two-part analysis included 160 patients who were treated with at least 7 sessions of CB-TIP for a 12-week period. The first analysis looked at outcomes in pre-treatment and 90-day patient-reported outcome scores, whereas the second analysis looked at those in a flexible treatment schedule by comparing pre-treatment scores with 90-day to 1-year post-initial visit scores. In the second analysis, the investigators identified a significant improvement in seizure frequency and anxiety symptoms. Only 10 patients had data from seizures per day in 6 months, and 50% of those improved by more than 50% in their number of seizures per day. Lastly, a postdoc analysis presented at the 2021 AES annual meeting showed that treatment with cenobamate provides additional seizure freedom benefit for patients with uncontrolled focal seizures taking 1 to 3 anti-seizure medications who were refractory to a prior epilepsy-related surgery. The data was from the long-term Phase 3 open-label C021 safety study, which included 1,347 patients aged 18 to 70 years old. In total, 240 patients had focal seizure data available, of which 177 were still receiving study drug as of data cutoff. Mean duration of time on study for those patients was 33.6 months. 85 or 35% of the available cohort had prior epilepsy-related surgery, and in this group, 23.5% achieved seizure freedom for at least 12 months since last clinic visit, while 30.6% achieved seizure freedom for at least 12 months during any interval. For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.